So what we're going to be talking about in this little series is how we can start to control the rib cage and the pelvis in patients that have foot pain. So what we're going to start with is something called an all fours breathing. What we want to work on is rib cage depression so I can start to create proximal stability. Remember, proximal stability precedes distal mobility. So think about someone who has an ankle restriction, for example. We want to make sure that the brain feels safe, and that will in turn start to free up ranges of motion in the lower extremity. So you're going to take a ball or a towel and you can put it right in between your knees here. You're going to place your left hand, and there is a reason we're only doing the left hand here. Oftentimes it's the left side of the rib cage that needs a little bit more compression. So I'm going to place my hand on a towel, the other hand on the floor. I'm going to twist my elbows back. So not out like this. We're going to just corkscrew them into the ground, and I'm going to round my spine. I'm going to hold this position, and I'm going to inhale slowly through my nose, and then I'm going to take a long exhale through my mouth. As I exhale, you should feel the rib cage, the sternum depress, and you want to make sure that you stay rounded the entire time. So again, inhale, slow, and then a longer exhale through my mouth until you start to feel the abdominals kick on a little bit. Okay, so we've just working on getting the rib cage depressed in that breathing posture. The next thing we want to work on is this left-sided hip. So you're going to take a ball and you're going to put it in between your knees. The right side is silent. Try to keep this right side quiet. You're going to get a little slouchy. So I'm not going to be sitting in this arched position. I'm almost going to sit off of my sits bones, so my low back is completely relaxed. The first thing I'm going to do is press my left foot into the floor slightly, and then I'm going to drag my heel back. So when I do that, you can see my knee shift ever so slightly backwards. What you don't want to do here is shift like this. So it's just a heel drag backwards, and you should feel your hamstrings start to engage. Remember, I'm still slouchy here. Once you pull the left leg back, then you're going to drive the left knee in. So the left knee now is going to squeeze the ball. You're going to feel the inside of your thigh. You're going to hold this for 10 seconds. You're going to breathe in through your nose, long exhale through your mouth. After 10 seconds is up, we're going to repeat that same process. Again, this is a tiny, tiny motion. I'm just dragging the heel back a little bit, and then I'm going to squeeze the ball with my knee. Some people will feel this left side start to shake a little bit. That's okay. You're going to feel a lot of activation of the adductor and a lot of activation of the hamstring. We're going to repeat that about 3 or 4 times. You want to make sure you're in this engaged position for about 60 seconds. So in our progression here, in continuing to establish proximal stability, good joint centration, which again allows for optimization of movement, we're going to be in a split and a half kneeling position. My left leg is going to be up, and there's going to be a foam roller into the wall. The first thing I'm going to do is take a long exhale and make sure that my rib cage is compressing. Think of my sternum kind of pulling down. I'm going to tuck my tailbone. You're going to feel a stretch in the front of the right quad. So you'll feel a stretch in through the hip flexor and in through the quad. From here, make sure that the left side is not hiked up. I'm going to drop that left side down. I'm going to gently press my left knee into the roller, and then I'm going to pretend like I'm sliding my heel back towards my butt, okay? I'm not actually moving the heel. It's just an isometric. So again, heel drag, and then I'm going to press the knee into the roller. I'm going to hold this position. I'm going to take my right arm. I'm going to inhale. And then as I exhale, I'm just going to take a little reach across my body as I continue to pull the heel back. So again, inhale and exhale, reach. As I'm reaching forward, I'm still driving my knee in towards the roller, and I'm still dragging my heel. So you should feel your adductor and your hamstring the entire time as I take about 4 to 5 breaths here. It's not a big reach. It's a tiny little, just a little reach across the body.